The current state of mental health care in Iowa is deteriorating at an alarming rate. 1 in 6 Iowans struggle with a serious mental illness. However, the public and private institutions can only care for less than 1% of these patients. Elle Loy, a student at the University of Northern Iowa, has dealt with mental illness since a young age.
I started experiencing a lot of issues with mental health when I was about 12 or 13.
I knew that she was hurting inside. I know that she had had some experiences before where she was just really hurt. She was still Elle. She was still bubbly, bright, funny, caring, charismatic Elle. But she just seemed sad.
I was actively suicidal several times from the age 13 on. And it's really hard to deal with any problems when all you can think about is just ending it all the easy way out.
The current suicide rate in Iowa is 13 per every 100,000 people. For every death due to suicide, there are at least 25 documented attempts. With the lack of care provided, this statistic continues to grow. And without support from Iowa legislators, access to mental health care will not improve.
Behavioral health care in Iowa is much worse in terms of people's access to care.
Well, there are a lot of things that are impacting mental health, but we don't have enough providers all across the state. What I've seen is there's been a higher need with children.
There are pluses and minuses about any way you go, but there are obviously people who are not receiving the level of care that they should have.
You know, we've worked on different pieces of legislation to make services available, and there are different ways of trying to address the needs of people and the population.
What do people need to do? They need to set the expectation for the legislature that as an Iowa society, we're going to respond to this problem.
In Elle's case, her mental health only worsened as she grew older. She was forced to seek options to treat her depression, but continued to run into barriers.
I went through a lot of losses. I went through a lot of traumatic experiences. And finally, my parents sent me to a psychologist, but she convinced my parents that I was just a normal preteen, that there was nothing wrong with me, that it was puberty and hormonal changes and normal 16-year-old girl, but that they should transfer me to a different school. And once I was able to feel more comfortable in the environment that I spent every day in, I was able to talk more about what specific problems I was having.
I knew that if she needed to talk to me about something, she would be more apt to opening up to me as a friend. If we just kind of let things happen, and if she needed to talk, I was always there.
My parents made an appointment with a child psychiatrist, and he diagnosed me with social anxiety, generalized anxiety, post-traumatic stress disorder, and clinical depression. I was put on a slew of drugs, none of which did anything but made me feel like just this shell of a person that wasn't even alive at all, and I just figured that maybe dying was a better option than feeling like that for the rest of my life.
Elle continued to battle her demons, overcoming overdoses and several other suicide attempts. Throughout the next 5 years, Elle tried to find relief from her depression and anxiety in a variety of different ways. Elle saw a psychologist, psychiatrist, hypnotist, and many other mental health professionals. However, none of these treatments could provide lasting relief.
Nothing ever seemed to have an answer, and I always felt like there was just something missing, that there was something wrong with me other than this huge file of disorders that seemingly kept building.
Several other Iowans, just like Elle, struggle with the limited services Iowa provides for treatment. In 2015, Governor Terry Branstad limited options even further by closing 2 of the largest facilities dedicated to treating serious disorders. These closings caused hundreds of patients to search for other options, forcing many out of state.
The mental health institutes, the governor closed 2 of those, and we've seen some real problems with that. He decided that it would be a wise choice to close those facilities, and while I think it's best to have people in the community, you have to have those resources there.
I can't help but think that closing these facilities has more to do with money than it does to do with what's in the best interest of the patients. There are arguments pro and con, and I just see that many of these people need more care than they are getting.
I get calls on quite a regular basis about, I've got somebody in my hospital and I can't put them anywhere.
I can understand that we want to save money, but a lot of the folks in these facilities need chronic care, and you can't depend on medication.
With lost hope from a failing mental health care system, Elle moved forward to what seemed to be a dead end, until she found a more extreme treatment.
The doctors in the behavioral health clinic approved me to go through electroconvulsive therapy. And they asked me what I thought would happen if I didn't go through with the therapy, and I said, I don't think what's gonna happen. I know that if this isn't changed, there's nothing else that'll work for me. There's nowhere else this can go. This is my last ditch effort. I was like, if this doesn't work, I'll find a suicide attempt that will.
Wow, like this is like a huge deal. This is something that could be extremely dangerous. Like they don't know a lot about it. Like what am I gonna do? Like what if she's not my best friend?
It was a grueling process. It was torture. It was the sickest I've ever been, with the most pain I've ever been in, and not being able to remember, or sometimes even not able to communicate what was going on. But after a few of the sessions, I started feeling alive, and my parents saw me smile for the first time in probably over a year.
Then slowly I watched her become the person that God made her to be.
I was a different patient. I got out of bed in the morning. I was dancing again. I was functional.
Elle is one of few lucky enough to have access to treatment options and the opportunity to find a solution that worked for her. The state of Iowa and its citizens have the responsibility to ensure that its people, like Elle, are cared for. Providing access, contacting state representatives, and lending a listening ear are some ways Iowans can make a difference. Elle's story may have had a happy ending, but there are thousands of Iowans that go through every day unable to find relief for their mental illness, unable to provide for themselves, and unable to live a normal life.
I just hope that we as a state look to treat people with mental health needs in a very positive and loving way.
I think everyone deals with some sort of mental illness at some point in their life, whether it's severe or not, whether it's clinical or not. Feelings are valid.
And there's no way to prove to people who don't understand that it is true pain. But the people who do understand, the people who have been there, are the kindest, strongest people you will ever meet. You will never meet an athlete, a bodybuilder, anything that is stronger than someone who has been at their wits' end, been their own worst enemy, and survived that. But I think surviving is a pretty great story to be able to tell. And I think that's motivation itself to make it there. I always told myself being a survivor is better than being a statistic.